Hello, everyone. Welcome. Thank you so much for attending. I'm Catherine McMahon, the program manager at Lupus LA. I've emailed with a lot of you and talked with a lot of you on the phones. It's really nice to see you here. Thanks so much for coming. I'm going to do a short and quick introduction because we want to jump right into our great agenda that we have tonight. We have a lot of really great presentations. We're really excited about it. I'll just give you a very brief overview of Lupus LA. If you're new to our organization, welcome. Thanks so much for coming. We do three main things. We raise funds to support medical research to help find a cure and better treatments for lupus. We offer patient services and support programs, so patient conferences, where we're at tonight is one of them. We also have really great free adult support groups throughout the area, and we would love to see you there also. And we have a grant program that can help if you have problems paying some of your medical bills or need help with a medication, please come see me and I can tell you more about that program. And we also do advocacy and awareness. I'm about to take a trip next week actually to go to DC to do some advocating with our representatives there. So we're excited about that. And lastly, we are capturing patient stories tonight. So if you would like to share your story, please see Brianna out at the information table, and we can do that. And we'll go ahead and get started with our first presenter, Dr. Sandhu. We're very lucky to have her here with us tonight. So please help me welcome Dr. Sandhu. Thank you so much.
Thank you. Thank you, everyone, for being here today. And thank you to Lupus LA for arranging all of this. There we go. Okay. All right. So I tried to keep this a practical talk that's relevant to everyone. So I'm not going to be talking about, thank you, clinical trials and what's going on, what's the phase, and I want to do something that's very specific to you as patients, to you as caregivers, and really just knowing anyone who has lupus. So a general informational session. Okay, so overview of the talk, we're going to be talking about what is lupus, why does it happen, some signs and symptoms of lupus, treatment of lupus, a little bit of what's in the pipeline, but more of what we already know that's out there. And then I'm going to touch briefly on lifestyle changes and alternative therapies in lupus, but we have two excellent speakers that are going to be doing a lot more than that. So I'm really excited about what that's going to be. Okay, so to start with, what is lupus? Lupus is a chronic, so long-term. It's a multi-system inflammatory disease. It's autoimmune, which essentially means we don't know why it happens, but it's your immune system that becomes dysregulated and essentially attacks itself. No two lupus patients have the same disease. I always tell this to my patients because while an event like this is great, you have one another for support and sharing stories, and it's nice to have people that you can relate with, but always remember that no two lupus patients will ever be the same. So if you read online that there was a patient who had a rash on their hands and now they're on dialysis, that doesn't mean that because you have a rash on your hands, you're going to end up on dialysis. So it's not the same course. Everyone's different. We'll talk a little bit about what populations are affected more and some of that, but just so that that's very clear, okay? This is my most complicated slide. What causes lupus? So again, nobody quite knows. There is a component of genetics. So yes, if you have a family history, you may be more prone to developing lupus, but that really only encompasses about 20% of lupus. So the rest of it, we don't really know. There are environmental risks. So for some people, yes, hormones play a role. There are exposures. So there's some literature on ultraviolet radiation. So essentially just being in the sun. That's a risk factor that somehow changes what we say, it's epigenetic, so it changes your genetic makeup in a sense by the exposure to UV light. Some infections, toxins, medications can be associated with predisposing a person to developing lupus. And usually what we say is that you have potentially some single underlying risk and then it gets tipped over because you have some exposure or something else that caused it to happen. And a lot of times what I find in my patients that have any autoimmune disease is it's I was fine until something happened, and then I developed lupus. So maybe somebody passed away, I got sick, got a divorce, got into a fight, got into a car accident. And what ends up happening is, and I say this because this is stress, right? So your body is exposed to some sort of stress. It could be a mental stress, a physical stress, some sort of emotional stress, and that tips your immune system over to activate and become dysregulated. So all the bad stuff is happening that's causing inflammation, and eventually tissue injury is what we see. So who gets lupus? In some older studies, a little more than 10 years ago, it's reported that the prevalence, so the number of people worldwide that have lupus, are 2 to 140 per 100,000. So it's a very big range. So 2 per 100,000 versus 140 per 100,000. So it's not, we don't really know how many people have lupus, and each population is going to be different. Health disparities in at-risk populations. So women are more likely to have lupus than men. So for every 9 women with lupus, 1 man has lupus. It is typically seen in women in their reproductive years, so younger women. And non-Caucasians have the highest prevalence, and they tend to have more severe disease. It was interesting because I'm showing you this prevalence, so 2 to 140. But the CDC funded a California lupus surveillance project in San Francisco County. So it's not here, so it's up north. But basically looking over a span of 2 years, how many patients had lupus? And 458 blacks per 100,000. 178 Hispanics per 100,000. 110 whites per 100,000, and 7 Asians per 100,000. The purpose of this project was really to see the breakdown of Hispanics and Asians, and this is what they actually found. So I bring this up because this is California, it's relevant to us. Here at Loma Linda, we do have a lupus registry, and I work at the county hospital in Riverside as well. We have a separate lupus registry just to keep track of how many patients we have that have lupus and their ethnic breakdown as well. So that's to be continued. So hopefully you'll see something published in the next year. Excuse me. Signs and symptoms of lupus. So when I teach our trainees, when I talk to our patients, I actually say, you see a lupus patient and ask them literally a head to toe exam. So do you have hair loss, any patchy bald spots? Do you have any vision changes? Do you have inflammation in your eyes, any skin rashes? It's not just the butterfly rash. It can be any rash. It can look like psoriasis. Do you have any sores in your mouth, sores in your nose? Do you get any chest pain or shortness of breath? Are you having any abdominal pain? Are you having Raynaud's? So do your fingers turn blue when you're cold? And then, of course, the joints. Blood disorders are also seen in lupus, and it can be really anything. It can be just as simple as having some anemia to a low white count. Platelets might be low. So essentially, anything can be lupus, contrary to what Dr. House says. So this is an example of some of the things I was talking about. I don't know how clear it is on the screen, but top left is the classic butterfly rash of lupus. Bottom left is discoid lupus. 2 totally different types of rashes. They're both on the face. No 2 lupus patients are the same. And then just kind of going through these pictures. So synovitis, that's just swelling of the joints in the hand. That's an example of arthritis, also seen in on the bottom, one of the x-ray findings you see of that gentleman's hands. And the arthritis of lupus can look just like rheumatoid arthritis. So it's not RA, it's lupus. There's an example of an ulcer, some Raynaud's where the fingers turned white. They can also turn blue. And then alopecia in the bottom right. Lupus on the inside, these are just some examples of some manifestations that we see. I won't bore you with that. So lupus intangibles, this is what a lot of patients, I actually just got an email from a patient a couple of days ago saying one of these symptoms, and she asked me, is this something that's a result of my autoimmune disease? So we'll touch on that, but achiness, headaches, fatigue, memory thief, brain fog, depression. How many of you have felt brain fog? It's a really common problem, really common. It doesn't mean you have lupus, but it's a common thing that we see in our lupus patients. And I wasn't trying to single out people who have brain fog because I get it all the time. But this is all the stuff that can cause brain fog. Okay, so depression, strokes, sleep disorders. I think that's why I get it. Vasculitis, antiphospholipid syndrome. I'm not going to even, TTP is that bottom one. Neuronal toxicity, so maybe from medications as well. How do I know if I'm flaring? So a lot of lupus patients have different ways, going back to that one line I had said, no two lupus patients are the same. So a flare can be completely different in any lupus patient. So just an example of some things that I often see. I see patients that will say, I have more fatigue, I feel more tired, I'm having chest pain, shortness of breath, my joints hurt, they're getting swollen, I have some fevers, chills, that rash that was only on my face sometimes is always on my face, or maybe it's not on my face, it's on my back. I have a patient who gets it on their back all the time. And then how we know is by getting blood tests and urine tests on you frequently and seeing, is your white count low? Are you becoming more anemic? Are your platelets dropping? Is your C3 and C4 low? So how many know what the C3 and C4 are? Because you don't have to raise your hand. But if you're my patient, you better know. So C3, C4. I tell my patients all the time, always know C3, C4, double-stranded DNA. Those are your 3 very lupus-specific tests. And I will talk about them a little bit more, but those are the things you should always know, and I'll talk about them, okay? And then, so complement C3, C4 are low. Double-stranded DNA is high. So C3, C4 low, dsDNA high. dsDNA is an antibody. So if your antibodies are high and they're higher, it's suggestive of your lupus being more active. And then finally, proteinuria. So having increased protein in your urine is a concern that we have, that you either are having a worsening lupus nephritis or a new onset lupus nephritis. So basically the lupus is affecting your kidney. So complement, C3, C4. Be wary of this. So even though I'm saying you should know what they are, when there are some people who always have a low C3 or always have a low C4 and they feel fine. So it does not mean that your lupus is active every time it's low, but it is helpful if you, for example, just arbitrarily, let's say your C4 is 10 and it's always 10 and that's considered low. If it now is 2 and you're not feeling well, that's consistent with you having a lupus flare. So there are numbers that we're looking at and it's always a trend. So if it's going down, we're worried that the lupus might be flaring. Similarly, if the double-stranded DNA antibody is going up, we're worried that you might be flaring. Now there is another blood test that is done. It's a more specialized lab, so it's not offered at all offices, but Exogen has something called CB caps. It's cell-bound complement activation products. Essentially, it's a specialized test that is more specific and less likely to put you in a case of, you know, my C4 or C3 are always low, and I don't know if I'm actually flaring or if it's, you know, related to my normal body physiology. So CB caps is something that we do use sometimes to monitor patients with lupus. Okay, so treating lupus. Treating lupus is actually very complicated. It's a multi-pronged approach. On one hand, we're treating autoimmunity. So we're trying to tell the immune system essentially to calm down and not cause all of the inflammation, not cause the tissue injury that it's causing, and to obviously by default treat your symptoms. So with this, we give anti-inflammatories. We give anti-malarials like hydroxychloroquine or Plaquenil. Another one that's given is chloroquine or quinacrine. Immune suppressive agents, I'm going to go into a little bit more detail of these, but some other ways that we treat lupus would be addressing heart disease. We want to make sure that you are not, and I'm going to talk about this a little bit more, but not having an increased risk of heart disease, because having chronic inflammation, lupus being active for days, weeks, months on end, can actually increase your risk of having heart attacks and strokes. The other thing is making sure that you're getting your immunizations. Now, if you are on some sort of immune suppressive agent, and that does not include Plaquenil, but if you are on some immune suppressive agent, you should just talk with your rheumatologist to see if it's a vaccination or immunization that you should be getting. But typically, if it's not a live vaccine, it's okay to take it. Now, if you are on Plaquenil, you can get all vaccines. And That's all relative because there are some patients that can flare after getting a vaccine. So it's not something that I can say is a hard and fast rule that you're not going to flare, but the recommendations are still to get vaccinated, okay? Other treatments are blood thinners. So if you're somebody who has an increased tendency for clotting, so for example, antiphospholipid syndrome, these patients get put on blood thinners. Then dialysis and kidney transplantation. That would be in severe lupus that's affecting the kidneys. And again, not all lupus that affects the kidneys is going to lead to dialysis and transplantation. How many FDA-approved treatments do you think we have for lupus? Medications. Come on, guys, we're better than that. 2, 3? We have 4. You got it. 4. I bet you didn't think of aspirin. So steroids, Plaquenil, aspirin, and belimumab. That's it. The 4 FDA-approved treatments. I recently saw a patient who I told her that she was not on an FDA-approved treatment, and she was taken aback. But then when I explained to her which 4 medications there were, she realized why she was on that medication. So what has happened with medications for lupus is that researchers have, for years and years, we've had medications that we know work. And in order to get an FDA approval for a lot of these older medications, we basically have to say, I'm going to put this patient on either nothing or this medication. And when we have research for years past that have shown that the medication works, just haven't bothered saying, hey, will you give us FDA approval? Patients still get the treatment. We have all of the safety data because they've been around for 30, 40, 50 years, but they're not FDA approved. So I think that is important to know and important to understand why it's so important to participate or advocate for research in lupus so that we can actually get more FDA-approved therapies. Steroids in lupus. How many have experienced side effects? You don't have to raise your hands, but side effects to steroids. Because I've been on steroids for other stuff and I've had side effects. So a lot of side effects. It can cause all sorts of things. Acne, increased body hair, easy bruising. So I've had patients that have come in with, they didn't even realize it. They were on 60 milligrams of prednisone a day and they said, I don't know why I keep getting all these bruises on my legs. Well, the prednisone is thinning your skin. You have a higher risk of bruising. Blurred vision. I've been on prednisone 80 for the last 3 weeks and now things are blurry, but it's not the prednisone. Maybe it's the Plaquenil. It's probably the prednisone. It's not the Plaquenil. And we will talk about that. Cataract, glaucoma, mood problems, difficulty sleeping. It can cause you to feel jittery. It can cause anxiety. It can increase your blood pressure and your blood sugars. It can cause weight gain, increased appetite, and aside from the weight gain, it can also cause you to have fluid retention, so the swelling in the legs. And then long-term stuff that's really important. Osteoporosis, fractures, delayed wound healing, avascular necrosis of the bone. So you've been on, let's say you've been on prednisone for the last 5 years or sometimes even less. I've had some patients that were on prednisone for 10, 15 years and 20-something-year-olds that have replaced hips because of the chronic exposure to steroids. That's a risk. So we know that steroids save lives. We know that they do. And that's why we prescribe steroids, because we know that they're there to protect your kidneys, they're there to protect your organ systems from becoming more damaged. But long-term, the side effects are horrendous. Unfortunately, now we have a lot more treatment options than we did before. So steroids in lupus are to be used as a crutch. When you are newly diagnosed with lupus, it's okay to take steroids for a short period of time to give your medications time to kick in. So let's say, for example, you're newly diagnosed, we put you on steroids, and then we say we're going to add Plaquenil, and maybe we'll add something else to it. Now, that something else is not going to kick in for another, how many weeks? How many months? Yeah, it can take up to 4 months for the medicine that we give you to kick in. So the hope is that we give you tapering, so lowering doses of steroids to give time for the medicine that we're starting you on to kick in. So short period of time. Now, if you're put on prednisone more than 20 milligrams a day, consider asking your doctor for, or don't consider, just to ask your doctor, calcium and vitamin D supplementation. And then also, do you need to be put on an antibiotic? Because when you're on more than 20 milligrams of prednisone a day, you have a higher risk of atypical infections. Now it's different if you're put on it for a short course, few days, a week, 2 weeks. But if we're talking you're going to be on more than 20 milligrams for a few months, then you should probably be put on an antibiotic to decrease your risk for some of the bizarre infections that can affect your lungs and other organs. Never stop steroids without the supervision of a medical provider. A lot of patients are used to steroids, they know how they work, they've been on them for a really long time, and so they kind of adjust on their own, stop it cold turkey. Just be careful, because being on steroids for a long time can actually psych your hormones out, and it can actually tell your adrenal glands that, hey, you don't need to make my stress hormone for me anymore, I've got this. And by doing that, if you stop your steroid, your prednisone cold turkey, you no longer have your normal stress hormones in your body, and you can actually go into shock. You can feel more muscle fatigue, your blood pressure can drop, so you can have a lot of side effects. That's actually why we have tapering doses of steroids. And on that note, when we do drop the dose of steroids, we do expect you to have some increased achiness as we're going down, especially if you've been on the steroids for a long time. Then dropping a dose even from something like 5 milligrams a day to 4 can make you feel more tired and achy. The hope is that with time, that gets better. It's not something that's going to stay that way forever, because as we go down on steroids, we actually want you to feel better. We're not trying to torture you by cutting down. So these are off-label therapies for lupus that are used. Not all of them frequently, but still they are used. So azathioprine, or Imuran, methotrexate, mycophenolate. Mycophenolate has a few names, so mycophenolate, Celcept, Myfortic. Leflunomide, or Arava, cyclosporin, tacrolimus, or Prograf, and then Rituxan. These are things that I see frequently in my clinic. They are all off-label, but they are used very frequently. I use them all the time in majority of my lupus patients. Essentially, if you're not on Plaquenil, if you're not on belimumab, you're probably on one of these other medicines. Studies that are underway right now, long list. I added a few new ones. This is essentially the same list from last year when I did this talk, but I bolded, I don't know if you can see the bold, but baricitinib, ustekinumab or Stelara, and voclosporin. These are studies that are underway. They're phase 3. I said I wouldn't say that, but they are later in the phase as far as research goes, which means they might show promising data for lupus patients. There are areas that are doing research in these where you could potentially enroll. It's all available online. Baricitinib has been shown promising results in rheumatoid arthritis, and it has also shown some data in lupus as well. Ustekinumab is actually used in psoriatic arthritis, but there is some data in lupus. Voclosporin is one of the ones that are actually being studied also in lupus nephritis, so that's nice because some of the data with belimumab is not there for lupus nephritis. It's typically used in patients who have, for lack of better words, more mild lupus, so skin, arthritis, fatigue. That's where belimumab has actually shown its most promising results. I always get asked about stem cell therapy and if there's a vaccine for lupus. Both are still being studied. There's Gary Gilkison at the Medical University of South Carolina has a big stem cell center and is doing a lot of work with stem cell therapy in lupus. And there is actually a vaccine that's being looked at to block interferon alpha for lupus. I'm sure that's way down the line. Now, limitations of therapies, as I already discussed, include toxicity, of course. So a lot of the medications that are used to treat lupus increase your risk for infection by reducing your ability to fight infection. So I always say it that way because it's not that you're going to get an infection by taking the medicine. It just means that if you are in a setting where people are sick, your immune defenses are brought down, and so you're less able to fight the infection. Okay, so that doesn't mean that if you're put on a medication, you need to wear a mask every day. It just means be mindful of your exposures. A lot of my patients are on immune suppressive therapy on a daily basis, no issue. So just being careful and watchful of how your body responds to things. One of the exceptions is that as far as immune suppressive therapies go, we don't consider Plaquenil an immune suppressive therapy. It doesn't actually bring down your immune system. It's actually an anti-malarial. It was originally discovered to treat malaria in World War II, so it's not actually something that's going to bring down your immune system. Infertility is always a concern with some of the medications that we give, so always speak with your rheumatologist about that if that's an issue or a concern. Now, cancer or malignancy, the medications that we give do not necessarily cause malignancy, but same concept, reducing your immune defenses. Thereby, if you already have a risk for cancer, you need to be monitored more closely. One of the exceptions for this is if you've ever had cyclophosphamide, just being very watchful for bladder cancer. So that's something that the rheumatologists are aware of. They usually have a protocol in place for when they do give cyclophosphamide, and it's usually shortly after if you have some sort of an issue that you'll actually be informed of any risks you might have. And it's not always bladder cancer. It actually, before any of that risk, it actually causes bleeding in the urine. So it's not bladder cancer, it's irritation of the bladder. So the reason why I mentioned that Plaquenil is not an immune suppressive agent is because a lot of patients do get stopped off their Plaquenil if they go to the hospital, they have an infection or something happens. It doesn't bring down your immune system. It doesn't need to be stopped. In fact, the data on Plaquenil is that it actually reduces your risk of having lupus flares. It reduces your risk of death from lupus. It reduces your risk of hospitalizations due to your lupus. So don't stop it unless you have an eye problem. And we can talk about that. But the data with lupus, with Plaquenil as far as retinal toxicity goes, so essentially the way I explain it is it can cause you to get freckles in the back of your eye, is if you've been on Plaquenil for, let's say for example, you've been on, and this is studied, if you've been on Plaquenil for 5 years, your risk of retinal toxicity is less than 1%. If you've been on it for 10 years, it's less than 2%. So the risks of having retinal toxicity from Plaquenil are really after being on it for a very long time. So absolutely discuss it with your rheumatologist, discuss it with your ophthalmologist, but the guidelines that are in place to have routine scanning of your eyes, they're in place for a good reason. We want to make sure that we detect it early to prevent any irreversible damage. So that's why they see some freckles, they stop the Plaquenil, you shouldn't have any further damage thereafter. So that was the treatment stuff. And I put this quote up just because I thought it was a nice quote as a theme for what Micah and Anna are going to be talking to you about in a little bit later. But I think for us as physicians, we need to realize that what Herbert Shelton said, he's an American naturopath from the early 1900s. He said that what the sick need is teachers, not treaters, health schools, not hospitals, instruction, not treatment, education and right living, not training the sick habit. Both they and their advisors must get rid of the curing idea and the practices built up thereon. There's an audio to this. I'll try it. You have to listen carefully.
If tomorrow morning the newspapers announce the discovery of another miracle drug, such as hydrocortisone,
Hydrocortisone.
the people will rush off that street and go, spend their hard-earned money and suffer and die as the cost of taking it. And the medical drug will make
All right, that's okay. I'll tell you basically what he was saying.
If tomorrow morning the newspapers...
Sorry. Okay. He actually he was talking about natural therapies, and so he was a big so as a naturopathic provider, his big thing was focusing on hygiene and health wellness, and not so much on medications. Now, I'm an allopathic doctor. I'm going to talk to you about medications and the stuff that's going to make your lupus better. If your organs are affected, I'm going to talk to you about the medicines I can give you. So I don't entirely agree with everything he said, because I think he didn't believe in vaccinations. He didn't believe in some of these other things. But it is important for us to realize that this is not all medicines that's going to make you feel better. There's way more than medications that are there to treat lupus. I can give you Plaquenil, I can say you need to take this Cellcept and you'll feel better, but there's a lot more that you need to do besides that, okay? So medications, naturopathic treatment, that doesn't mean you need to go see a holistic doctor and be put on therapies, which is fine, you can. There's nothing wrong with that. As my cultural background is very much in favor of holistic therapy, but I always say it should complement your allopathic treatment with some exceptions, but really if you have severe lupus, if you have lupus that's affecting organs, then it's probably not a good idea to just do lifestyle changes. You should probably complement it with some medications. But by all means, always discuss this with your doctor. Always discuss it. If you ever feel like your rheumatologist or any doctor that you're ever seeing is not listening to your needs, if you feel like you're not comfortable with the medication that you are prescribed, talk to your doctor, because there's no one is there to gain anything out of telling you to take a certain medicine. It's really important for you to feel comfortable with your provider so that you can actually tell them, hey, you know what, I don't want to take this medicine. I'm afraid of these side effects. And see if the doctor feels, I mean, a lot of times my patients don't feel comfortable with the medicine I'm giving them. I talk it out with them. I say, here, look, these are the options. This is what we can do. Think about it. Go home. Here's all of the education you can get on this therapy. If you want to do it, message me, we'll do it. If you don't, we'll think of something else. You need to have that established relationship with your rheumatologist, because otherwise you cannot manage your lupus on your own. You need support. You need support. Yes, you need family support, social support, which is another thing on this slide, but you really need to feel comfortable with your provider. And then behavioral therapy. We all need therapists. I don't know what everyone's saying about, I'm worried, I don't want somebody to think that I'm crazy if I see a therapist. We all need therapists. We all have stress in our lives, so behavioral therapy is so important. We go to the doctor when we have something little right here, and can you just look at it and no, it doesn't bother me, it's something small, but we do that all the time. I do it. But then if we're stressed out and something is overwhelmed, we don't go to anyone and we just kind of suck it up and deal with it. So all of these stresses, especially in autoimmune disease, they affect your daily life. It will cause you to flare. It will make you feel horrible. It's important to see someone. See a therapist, a counselor, a psychologist, whoever you want to see someone. If you want to tell people, tell people. If you don't, don't. But this is a horrible cultural problem we have about not being open about seeing therapists. So I'm just going to be the one to say that we should all be seeing therapists. I've seen a therapist. If you haven't seen one, consider seeing one. And if you don't know what to talk to them about, I'm sure you can find something. Okay, so again, Micah and Anna are going to be talking about complementary medicine in lupus, so I'll be really quick. This is an old paper from 2013. That's old now. Updated review on complementary and alternative medicine treatments for lupus. They talk about natural products, mind-body techniques, manipulative treatments. And I know that some more of this is coming up in a couple of other talks, but vitamin D, there is literature that shows vitamin D deficiency is associated with lupus disease activity. So most of my patients will say, can you tell me why you're getting a vitamin D level on me? That's why. So a lot of times when your vitamin D is low, it amplifies pain. It can be associated with fatigue. And there is data that's shown that it is actually associated with lupus disease activity. So other vitamins that have been shown to reduce the risk of active lupus include B6 and vitamin C. Omega-3 fatty acids and fish oil have been shown to be cardioprotective and anti-inflammatory. Turmeric. Micah, are you talking about turmeric? Or Anna? Okay, Anna's talking about turmeric. Okay, so turmeric, it will be discussed later, but Micah and I will be hopefully, along with Anna, be doing a randomized controlled trial here at Loma Linda soon on turmeric in lupus patients. Other treatments that I'm all for and that have shown beneficial effects in lupus include acupuncture, seeing a chiropractor, mind-body therapy, relaxation techniques, problem solving. This is not voodoo medicine, guys. This is real. It works. And psychiatric disorders are higher in lupus than in other chronic inflammatory diseases like RA or ankylosing spondylitis. So this is a thing. It's real. Data has shown it. So by practicing some of these other therapies, it's shown to reduce pain, stress, fatigue, anxiety. And even if you don't have lupus, you should probably be doing a lot of this. So cognitive behavioral therapy, how many have heard of cognitive behavioral therapy? I'm a huge advocate for this. Okay. So it's really interesting. It's scientifically proven. It's shown that essentially if you, let's say you're connected to a heart rate monitor or something that's monitoring your sweat, your temperature, and you're asked to think of something stressful, you physically see these numbers go up. And at the same time, well, after, not at the same time, you're asked to think of something that's relaxing, however hard that may be. If you're truly thinking of something relaxing and not just faking it for the provider, your numbers will actually go down. And this is a way to actually train your body to address fatigue, pain, stress, anxiety, and you actually learn how to do it with the numbers right in front of you. It makes you more likely to practice it. So as I said, it's beneficial in anxiety, depression, and lupus. And then group CBT is also beneficial. Actually, aside from the fact that it's in a group, it makes you feel like you're not alone, but it also reduces a lot of these symptoms and decreases your vulnerability to stress. So some other components that are in behavioral health include biofeedback, so increasing your body awareness, like I had mentioned, and physiologic relaxation. Meditation is really, I can't meditate because I fall asleep when I'm meditating, so I get so relaxed. But meditation is actually really helpful. My husband meditates every day, and it really helps him. So, I mean, if it's something that, for me, meditation is just my car, driving, listening to music, and meditation is different for everyone, and it really just needs to be your relaxation zone. You need to give yourself time in a day to be able to be at one with yourself, okay? Some more of these mind-body techniques. So mindfulness-based stress reduction. If you type in MBSR online on Google, there's actually a free test and some training online that actually teaches you how to practice mindfulness, which is a nice thing. And then there's Tai Chi and Yoga. I added this to my talk last year too because there were too many people who wanted to know about it. I don't prescribe, I don't necessarily advocate for medical marijuana or CBD, but I do have a lot of patients that use it. I have a lot of patients that ask about it. So here's some information. So cannabis sativa is known to improve pain, appetite, sleep, and mood. The problem is that it has some psychoactive properties that can lead to recreational use. Now, there are medical benefits, of course. I used to use it to treat patients who had cancer back when I was doing my training because it does improve appetite. And of course, it improves sleep, anxiety, depression. It improves a lot of stuff. So CBD has been found to be very beneficial in a lot of diseases. But I will say this, don't smoke it. It's bad for your lungs. Smoking is bad for your lungs anyway. If you're going to use medical marijuana, don't smoke it. Smoking by itself, just on a side note, smoking does, in some diseases, for example, rheumatoid arthritis, tobacco smoking does actually activate the immune system and has actually been associated with a direct link to causing rheumatoid arthritis. So risks, cannabis by itself increases the risk of a heart attack by 5-fold. Some may know that it is associated with impaired reaction time, selective attention, short-term memory. It can cause you to have a fast heart rate, low blood pressure, anxiety, and agitation. On the flip side, it can also relax you and not cause all of these symptoms in moderation. So I will leave it at that and not give any direct recommendations. Morbidity and mortality in lupus. So long-term complications and death, basically, is what that's saying. So people that are at risk for long-term complications, if you have active lupus and if you have an infection early on, that increases your risk. So for example, new lupus patient comes in and is really sick, maybe has involvement of the heart, the lungs, also gets complicated by all these infections. They have a high risk for long-term complications. So it needs to be addressed very quickly, very early. Individuals who have high disease severity at diagnosis, those that are diagnosed at a younger age, males with lupus, ethnic minorities and low socioeconomic status. There's a lot of data on individuals living in poverty that have poorer outcomes in lupus. And that's kind of the concept of healthcare disparities. So basically, what is what? So is it that we're living in a low-income area and we have poor access to healthcare providers? Is it low-income area, low social support group? Is it that, you know, because there's just a lot of factors. Is it, you know, the amount of money that I make that's coming into play? So this is constantly being studied here in the lupus community, because it is known that ethnic minorities and low socioeconomic status patients have it worse. And here, even at Loma Linda, we actually have, we've done some research on this. So as a tertiary care center in rheumatology, we actually cover something like 3 million population. So there's a huge population, and there are people that travel long and far to come see a rheumatologist here. So that just tells you, I mean, I don't know where the furthest person who's here is from, but people that travel long and far to see a rheumatologist, so that's hard. I already touched on this. Infections, touched on that as well. Medications that can be associated with an increased risk, decreased ability to fight. And then cancers, make sure you're getting your cancer screening done. Heart disease, I believe Micah's going to be talking about that. So bone health, I mentioned the risks of steroids and what it can do to your bones. Individuals that are on steroids that have lupus are 5 times more likely to fracture from osteoporosis. So if you are on steroids, please talk to your doctor. If you do need to get a bone density scan, not everybody does, but if you are on steroids, you should at the very least be on bone protective medications. Okay, so in summary, I didn't talk about this, but how many are familiar with what an ANA is? Anti-nuclear antibody. So it's the screening test for lupus. Not everybody with a positive ANA has lupus, but 99% of patients with lupus have a positive ANA. So if you don't have a positive ANA, you could be the 1%, but 99% of lupus patients have a positive ANA. But a lot of patients that don't have lupus also have a positive ANA. You could have a thyroid problem, you could have MS, you could have an infection. You could have an infection and have a positive ANA that then later normalizes. So that's a really important thing I actually teach our doctors as well, because not all ANAs are lupus, and it can actually be really scary if your doctor gets an ANA on you and then tells you you have lupus when you don't. Okay. Never stop steroids without discussing with your doctor. Always talk to your doctor about your steroids. Never stop your Plaquenil without talking to your doctor, unless your ophthalmologist said that there was something wrong with your eyes. Don't smoke. Please exercise and consider mind-body techniques. Thank you. Any questions? Are we doing it any certain? Oh yeah, we are. Okay. Oh yeah, so I think all of you have index cards. So if you have any questions, just write them on your index card, and then I'll try to answer as much as I can. Do them as we go. Okay. So what if a patient is severely allergic to Plaquenil? Don't take it. Don't take it. If you're allergic to it, sorry, that was the other exception. So if you have an eye problem, don't take it. If you're allergic to it, don't take it. I have had patients that have had really bad skin rashes with their Plaquenil, and I have actually tried them back on it, only if it was a small rash and not a severe rash. But if you have a rash with Plaquenil, don't take it. Your doctor will put you on something else. That's okay. There's always belimumab. How many times should you retest for low vitamin D once you have been taking supplements? So good question. So I make sure that my lupus patients have their vitamin, actually I try to make sure all my patients have a vitamin D level checked at least once a year. If it was low and it was replaced, then after doing once a week, so it depends. If it was really low and you're put on once a week vitamin D, then I tell you to take 1,000 to 2,000 units a day daily thereafter, and I'll check it again after that. So usually I'll say once or twice a year. I have that rare patient who ends up keep needing a lot of vitamin D, and so I end up checking it every 3 months. But that's not routine, and your insurance will not cover that. Okay, so the question was, what is considered too low? Depends on if your rheumatologist is treating it or if your primary care doctor is treating it. I treat a vitamin D level that's less than 30, always. If it's less than 30, then I treat it. You should be on a supplement anyway if it's less than 30, or at least be supplementing it in your diet somehow. But some lupus specialists say that it needs to be more than 40. I just say I need it above 30, and if it's less than 30, I'm going to hit you with the heavy dose of once a week. But most primary care doctors, I believe my understanding, and Micah and Anna can correct me, but if it's less than 20, they usually replace it. But if you're less than 30, I'm going to give you 50,000 units once a week, and I'm just going to keep doing that until 50,000 units once a week. It's a prescription. Yeah, it's a prescription. All right, so what medication can substitute ibuprofen 800? There's a lot. So ibuprofen is an NSAID. It's synonymous with Motrin. Motrin is 200 milligrams. Ibuprofen is an 800 milligram version of Motrin. So naproxen, there's meloxicam. You can do, so, you know, there's people who take ibuprofen and it doesn't work as well, and naproxen might work better. Meloxicam might work better. Celebrex or celecoxib might work better. So everybody's different. Sometimes you kind of have to experiment with them. And then sometimes maybe it works a little, and then you might need to take a Tylenol. And it's okay to do that, to take a Tylenol after ibuprofen because it didn't kick in enough. In moderation, so don't remember these things do affect organs, so you don't want to be taking too much. What are the chances of my children getting lupus? Percentage for my son, for my daughter? I can't give you a percentage. The risks are so variable. I mentioned it's basically 20 to 25% of your genetics are passed down. It's hard, 20 to 25% of lupus onset is related to genetics. So how much of that ends up being what is the case in your child, your son or daughter, it's hard to say. I can't really give you a percentage, I'm sorry. But I think attending talks like these help you be mindful of what symptoms to look for. And if you have lupus, then you kind of know what symptoms to look for. You don't want to just screen your child for lupus, because then you're potentially exposing them to medications that they may not actually need. If you're prescribed Benlysta, does that mean that the disease has gotten worse? No. It actually doesn't. So what I had mentioned earlier was, belimumab, the research in Benlysta or belimumab was actually in patients that did not have severe disease. So it was not meant for people who have lupus nephritis or lupus affecting the brain. So it was only meant really, and actually showed maximal benefit in people who have fatigue, skin rashes, and joint pain. And those are actually the patients that I put this on. I put them on Benlysta if they have these kinds of symptoms. So my doctor is 50-50 whether I have lupus. I'm taking Plaquenil and he may stop it later. Question is, can you stop it cold turkey? Yes, you can stop it cold turkey. And I know I had mentioned earlier that not all ANA is lupus. If you have a positive ANA and then you have, let's say, 5 family members who have lupus, so that would increase the chance of you having lupus, then there are patients that I'll say, look, you have some joint pain, you have a positive ANA, maybe you get a rash here and there, but you may not, maybe it's all a little bit vague and it's not clear on whether it's lupus or not. I'll also give Plaquenil, because there is some data that shows that Plaquenil does potentially reduce progression or onset of lupus. How can I get you to be my rheumatologist? I have back of thigh or knee bruising and legs. I don't see a question on that, so I'm going to just ask if you're on steroids. Sorry. Are you familiar with Lupus Vita? What do you think of it? I'm not. I've never heard of Lupus Vita. Is lupus related to fibromyalgia? Tricky question. So fibromyalgia is a condition where a person has pain and we have no idea why they have pain. So is lupus related to fibromyalgia? No. But fibromyalgia means I have pain, I don't know why I have pain. That's what it is. It's a symptom. It means you have pain, it's everywhere, and you have no idea why you have it. So if your physician has not checked a vitamin D level on you to make sure you're not vitamin D deficient, maybe that's why you have pain. Maybe you have pain because you have arthritis and you have swollen joints. That's why you have pain. That's not going to be fibromyalgia that's causing that pain. If you have active lupus, you may have symptoms of fibromyalgia. My whole body hurts. I'm really tired. My bones hurt. My muscles hurt. Everything hurts. That can happen when lupus is active. Yes, it is called fibromyalgia in some patients, but we call that secondary fibromyalgia. I try not to call it fibromyalgia only because I'm being very clear. This is your lupus flaring up that's causing your symptoms. I don't want you to be mistaken that it's your fibromyalgia flaring. It's your lupus that's making you feel so horrible, and that's causing you to feel fibromyalgia symptoms. Does that make sense? Okay. It's really tricky because fibromyalgia gets labeled, but then nobody knows what to do with it. Lupus, when it's flaring, we actually know what to do with it, okay? What are all the ways you can contract lupus? You cannot catch lupus from anyone. And nobody really knows how it happens, so that I had kind of brought that up in the beginning, that we don't really know how it's contracted, but if we say it's caught by someone, it could be a genetic component to it. Yes, that's different. Okay, so good question. Thanks for adding that. So neonatal lupus is essentially mom with lupus that has a positive antibody, for example, a positive SSA antibody that she passes down to child. Child separately is at risk for having congenital heart block because of that SSA antibody. So just on a side note here, if you're a young female patient who has lupus, or if you know somebody who has lupus that's younger and wants to get pregnant, they should always get tested for SSA antibody because it does increase baby's risk for congenital heart block. That doesn't necessarily mean the baby's going to get lupus. It just means that that antibody can affect the baby's heart. That's one thing. Neonatal lupus is basically when the baby is born, they still have mom's antibodies in their system, and that can cause the baby to be born with a lupus rash, actually. And they can be red and just have this horrible rash. But then 6 to 12 weeks later, when mom's antibodies are out of the system, that neonatal lupus gets better, typically. Okay? Now, if there's something else that's going on, that's a different story, but that's the classic story of neonatal lupus. Mom's antibodies go out of baby's system because baby's now making their own antibodies. Why did you only say sativa, why not indica in the medical marijuana? Because I don't know enough about it. I was just trying to touch on it. Sorry, guys. Is there a safe medication to help me sleep at night? That's hard. If it was no medication, that would be the best medication. And I say that in the sense of if you're able to get by doing some of these mind-body techniques, practicing meditation, having some sort of naturopathic approach to addressing sleep issues, that would be ideal. If you think about it, there's no real safe medicine that helps us sleep at night. It's a medicine that's telling your brain to shut off. So while I'm guilty of taking a Benadryl every now and then, and I know a lot of people that are on sleeping medications, and I don't reprimand them for being on it, if you think about it, if we are having to take a medicine to go to sleep at night, that's not healthy. It's not something that needs to be addressed. So if there's other approaches to addressing insomnia through some of these other natural approaches, try them. Try stretching techniques at night. So all my relatives in India, they always drink a glass of milk because it has that melatonin effect without actually taking the melatonin. So they just take a warm glass of milk and they'll add some turmeric to it, and that's what they take before they go to bed. My dad does it every night. I need to start doing that. Okay, so what if you have had bariatric surgery? What other medications can you take for pain? I'm going to actually defer that to your GI doctor because that's not going to be a lupus-specific question. And then I am interested to know a little bit more about Lupus Vita if somebody wants to talk to me about that later. I think that's all. Thank you.
Thank you so much, Dr. Sandhu. That was really great. So before we begin our next presentation, I'll just make a quick announcement. We are keeping the food out until 8 o'clock. So if you came in late, you didn't get a chance to get dinner yet, or if you're on the wait list and you didn't get a chance to get to dinner, you can get it. You can get it now, or you can get it at our break after the next presentation. It's just out to the left. And now we'll get started with our next presentation with Dr. Lafian. Thank you.
Hello, everybody. My name is Anna Lafian. I hope this thing doesn't tip over. I'm a rheumatology fellow here. I'm a first-year rheumatology fellow, so about more than halfway done with my first year. Let's get started. All right, so I'm going to talk a little bit about myself, and then we'll get into the topic. Everybody can hear me okay? I shouldn't shift. Okay. So my interests are optimizing one's health and wellness to allow the body to heal itself. So Dr. Sandhu touched a little bit on how there are complementary and alternative things that we can do to help our health. And I am a big, big believer in the fact that the doctor helps and assists with giving, the medications and things that we have nowadays that alter these diseases and save lives. But ultimately, the body needs to get back to peace and a balance so that it can heal itself. So the alignment of body, mind, and spirit is kind of what helps ensue or basically helps the healing process. So I have an interest in integrative rheumatology. There are a lot of different definitions about integrative medicine, complementary alternative medicine, functional medicine, but my background is that in complementary and alternative medicine. So before going to medical school, I actually did a master's in this field. So all of the things that Dr. Sandhu talked about, which I will actually be talking about as well, is what I studied. So alternative modalities to treatments and things like that. And then the big focus of my talk is going to be on the gut microbiome. So we'll get into that. So I have no disclosures. So the objectives and the outlines of this talk are going to be the following. But before I go into all of that, I'm going to give you a couple disclaimers. So the disclaimers are that this field of the gut microbiome is relatively new. It's newish. I mean, it's been going on for some time now, but initial studies were not as promising, and now there's a huge field that we'll basically be talking about. And I'm a new fellow, so I may not be able to answer all of your questions with 100% certainty, but I'll try my best. So we'll talk about what the gut microbiome is, what its role is in autoimmunity, what affects the gut microbiome. We'll touch briefly on what microbiome in lupus, but what I wanted to kind of mention here is that the microbiome is affected in all types of autoimmunity. And so everything that I talk about is, has some association with lupus, but it also has an association with rheumatoid arthritis and inflammatory bowel disease and multiple sclerosis and all these other autoimmune diseases as well. So, and then ultimately, I kind of tied it all back into what can you do to achieve better microbial diversity, which I will define, but also overall how you can achieve improved immune strength. So the things that actually I will talk about are diet, stress management, sleep, exercise, and then this term immune strength is not mine, so I won't be taking credit for it. I actually recently listened to a podcast that featured Dr. Leonard Calabrese, who's basically a pioneer in our field of rheumatology, and he coined this term immune strength, and I'll kind of get into that as well. And the ultimate goal of this talk is basically to empower you to tell you what things that you can do for your health and for your immune system. So a very wise doctor once said, all disease begins in the gut, and we'll talk about why. So what is the microbiome? So the microbiome is basically all of the organisms that live in and on our bodies, okay? And it's not just bacteria, but viruses, fungal organisms, protozoa, and this is just baffling. So how many microbial cells actually inhabit one single person? So 100 trillion in the large colon alone. And this is profound to me. When I first heard this, I was kind of blown away that your body has 100 times more bacterial DNA than it has human DNA. So if you think you are the controller and ruler of your body, you are wrong a little bit. So 1 to 2 kilograms of our body weight is actually made up by the flora that live in and around us, on our skin and everywhere else. So I found this picture when I was doing this talk. It's really interesting. So you can see all the different microbial and organisms basically surrounding a body. So what's kind of led us to the research advances that we are able to achieve with gut microbiome is actually microbial sequencing. So the fact that we can take a sample from different parts of the body, from skin swabs, nasal swabs, mouth swabs, from stool, and actually assess the genome and assess the DNA that is made up of that sample. So we can actually, just like how we can map the human genome and our human DNA, we can actually map our microbial DNA. And so we use techniques like DNA sequencing and RNA sequencing. And the fascinating thing that is kind of taken place in the last few years is that we can even tell what the byproducts are of those bacteria. So not just what bacteria live inside of us, but what byproducts they actually produce. And so here's a little figure of just like genomic mapping, microbial genomic mapping. So and I understand that this is kind of overwhelming, and especially if you're hearing about it for the first time. So a lot of, when I first heard about it and I started getting interested in it shortly before I started my fellowship, I've basically since then listened to tons of lectures and read a lot about this, and I still get blown away when I was putting this talk together about the information that's out there. So the gut microbiome is actually imperative to your digestion and your nutrition. So when you're eating, you're not feeding yourself. Think of the fact that you're feeding your gut microbiome. You're feeding all of those trillions of bacteria and cells that basically live inside of you. So, and what happens in turn is when you eat and you feed yourself and you feed these gut microbial cells, they basically generate the nutrients that you need to control all of these things that I'll be talking about. So for example, research was done that this specific bacteria, the Bacteroides, produces the nutrient xyloglucans. So lettuce and onions, for example, contain these. They also can produce short chain fatty acids, and usually in the indigestible fibers, so the vegetables that we eat. So, and then they did some studies that actually show that short chain fatty acids modulate immune responses. Another bug, Clostridia, actually generates this byproduct called butyrate. And what butyrate does is it promotes the growth and expansion of an immune cell called the Treg cell. So to us rheumatologists and immunology nerds, that's it's really fascinating in that it directly affects the immune cells. And then another study found that butyrate actually also inhibits tumorigenesis, so basically the prevention of tumor cells from forming. So what we put in our body and what's at the end of our fork directly influences the microbiome, which directly influences the byproducts of them and what our body can do. So what else does the microbiome do? Does it control everything really? Because there was a long list of things that I could find that it did. So it controls levels of inflammation, permeability of the gut, and we'll talk about that a little bit. I'm sure a lot of you have heard about the term leaky gut. the brain chemistry, our hormones, and our metabolism. So what is dysbiosis? So dysbiosis basically means that the microbial balance in your gut flora is disturbed. And basically that usually translates to a decreased diversity of flora. So you don't have that, vast, nice, rich, basically garden. So you want your flora to be like a garden. You want it to be diverse. You want it to have all sorts of different species. So at this point in time, basically dysbiosis has been linked to countless diseases, some of which I listed here. So a lot of the immune-mediated diseases like lupus, rheumatoid arthritis, psoriasis, IBD, which is inflammatory bowel disease, multiple sclerosis, on and on. Obesity, metabolic syndrome, and diabetes, some cancers, autism, Parkinson's disease, and the list, like I said, goes on and on. And this isn't just something that I'm listing with no merit or background. They actually, if you look through, I'm not going to go through all of this, but you can see, I'll talk about the factors listed up top and how those affect your microbiome, but everything in between is actually the things that have been studied directly demonstrating the changes of the immune cells in our body. And for example, looking at the second disease in rheumatoid arthritis, they've done tons of studies finding that in the gums, the oral flora, and periodontitis causes like an increase in P. gingivalis, which directly actually causes the antibody that we measure in the blood to diagnose rheumatoid arthritis. So this is just, demonstrating that there is a lot of studies and science behind these concepts. So is dysbiosis alone the cause of your autoimmune disease? No. So I don't want you guys to take these concepts or take this concept and think, oh my God, it's because, my gut flora is all messed up. That's why I got lupus. That is not the case. So just like Dr. Sandhu mentioned, it's multifactorial. A lot of times, there's a concept of the triple hit or, the trilogy. So genetics is a component, environmental triggers, the diet. We'll talk about pesticides, UV light, oral contraceptives at times, certain viruses, and then leaky gut, which is basically, interchangeable with dysbiosis, and I'll kind of talk about what leaky gut is. Sorry. So back in the day when certain functional medicine doctors coined the term leaky gut, we in the Western world as allopathic doctors kind of laughed at them because we were taught that the gut lining is tightly packed and that nothing can get across the gut lining. And now there's this belief, and it actually has been proven, that dysbiosis or intestinal inflammation, and those kind of can go back and forth, actually does cause an impairment of the gut barrier. And you can get the bacteria from your gut actually translocating through the colon and leaking into the blood. And then once you get into the bloodstream, that basically can go anywhere in the body and cause downstream effects. So it can go into the joints and cause rheumatoid arthritis, and on and all the other diseases we mentioned. So here's another slide depicting the different factors that can leads to dysbiosis and an altered microbiome. And so the question is this the missing link? So genetic and environmental factors that can influence autoimmunity both directly and indirectly by affecting the immune system and the immune function. And so we'll talk about that a little bit more. So my question was, wouldn't it be great if we knew somebody's genetic predisposition and could intervene at the stage of dysbiosis to help prevent the disease from progressing and actually coming up? So what does your microbiome have to do with your immune system? Well, I kind of showed you guys some studies about the cells that can be upregulated and all of that, but some studies say 80% of your immune system is actually in your gut. It's your first line of defense. Everything that goes into your gut basically has to be filtered through and fought against if it's something foreign, if it's a pathogen. And food is the biggest thing that actually ends up there. and our immune system needs to look at it and see if it's going to cause a problem for us or not. This other portion, the nervous system in the gut, was fascinating to me as well. So the gut-brain axis is this concept that basically that there's a connection between the gut and the brain. And I'm sure all of you guys know this, because if you've ever been in a stressful situation where you had to give a lecture, or you had to have a really important interview or whatever, you ran to the restroom like 2 minutes before because you had to go. So there is directly a correlation between the gut and the brain. And that more and more research is finding that link is actually through the vagus nerve, which is a nerve that travels from the gut all the way up to the brain. And what the vagus nerve does is actually talks to the microbial cells. It picks up the microbial metabolites, or the information from the microbial metabolites, and it transfers the information to your nervous system, to your brain. And there have been studies that have shown that stress actually inhibits the vagus nerve. And in diseases like inflammatory bowel disease and IBS, those patients have a low vagal tone. So what affects the microbiome? And I'm going to go a little bit quicker now because I'm talking too much. So this is really fascinating. So early life. So in early life, there are huge effects actually on the gut microbiome. So we used to think, again, that when a mom was pregnant, that womb and the baby was in a completely sterile environment. And that's actually, we're finding now that that's not true. So there have been studies actually looking at the placenta and looking at the microbiome that lives in the placenta. They've actually been able to do genomic sequencing on those bacterial cells. There was another study that looked at the microbial colonies of amniotic fluid, and then also umbilical cord blood. So it's fascinating that really the mom's microbiome can actually translate into the foundation of a baby's microbiome when they're born. Another thing that, there has been a huge shift in through the last more than that, probably decades, is C-section delivery. So the rates of C-section deliveries have gone up. So when that happens, the baby actually has no exposure to mom's vaginal flora and is born basically to hospital flora. And so there's a huge difference when you're actually coming out of the vaginal canal to be bathed in mom's vaginal flora, and that basically starts setting the foundation for your flora. So actually what hospitals are doing now is after a baby is born via C-section, they'll swab the vagina and kind of put it around the mouth and the nose of the baby, which sounds kind of creepy and gross, but it really isn't, because the baby needs all of that good bacteria. Now, I'm not saying that C-sections are terrible and no one should ever have a C-section, because this is actually, life-saving in certain times and appropriate situations. But, if your OB-GYN doesn't want to be on call and doesn't, wants to deliver you by C-section and not vaginally, that's not a good enough reason. So breastfeeding versus formula feeding. And again, obviously, there are certain situations in which babies need to be breastfed because fed is best. But the breast milk actually contains a ton of, or especially the colostrum in the first couple of days, antibodies. That also sets the immune system for the baby for like the 4 to 6 months of their life. And breast milk is actually loaded with good bacteria. I didn't really realize that breast milk in and of itself actually contains bacteria. And the compounds that breast milk also has are directly, now we're finding that they're basically food for the baby's bacteria. So these products are food for baby's bacteria. So the foundation, one's foundation is actually set as far as their microbiome within the first 6 months to 2 years of life. And this is also fascinating, antibiotic use. So antibiotic use has been actually shown, especially if used early on in life, to lead to a higher incidence of JIA, which is basically the equivalent of rheumatoid arthritis in babies. So again, it was dose and time dependent, which basically means the more antibiotics they got or more frequent they got it, and then at an earlier age, they actually were predisposed to having JIA. Again, antibiotics are needed at times of really serious infections or whatnot, but using antibiotics for a viral infection or some common cold, we should really be thinking twice about. So other factors, and I'll get into most of the things on the left column: diet, medications, stress, lack of proper sleep, lack of exercise, vitamin D deficiency, not enough time outdoors. Back in the day, our ancestors basically farmed and did their own thing. They were out there playing with the soil, and the soil contained all this good bacteria they were constantly exposed to. We don't do that anymore. Environmental toxins, and I really just listed a few off the top of my head, but there's just so many out there. BPA, chemicals in cleaning products, endocrine disruptors in like makeup and skincare, and our obsession with cleanliness. Hand sanitizers, antibacterial, Clorox wipes, everything needs to be, kill every single species of everything in our house. And that, in and of itself is also problematic. So the hygiene hypothesis, which is basically a hypothesis that's been around for autoimmune diseases, just say that, nowadays we get way lower exposure to infection and way lower exposure to these pathogens. And that might lead patients to having more asthma, more allergies, more autoimmune disease. So this is just an image of a summary of kind of what I've been talking about leaky gut and how that actually directly increases certain immune cells, which can then travel to the joint and cause inflammatory arthritis. So here's a little bit more about lupus and the microbiome. So there was a study that actually found alterations in the composition and the metabolic functions of gut microbiota in lupus patients. And that's not surprising, right? Everything I told you already kind of led to this. And that there was another study done in mice, found that lupus-prone mice had a significant reduction or decrease in the Lactobacilliae strain of bacteria and an increase of Lactobacillus. So what does this mean? And that in and of itself actually around the time of disease onset and in the late stage of disease. So what does this mean for us? Because there are tons of studies that say this disease has an increase of this bacteria and that disease has a decrease in that bacteria. So what does that mean? It basically means that in the future, our therapies can be targeted to the specific gut alterations that we have. And lactobacillus actually is found in the probiotics that we use. So can probiotics be used to help treat lupus? That's a question that these researchers put out there at the end of their talk. And then there was another study that showed that some lactobacillus strains actually had specific effects on the gut microbiome by inhibiting the formation of nets. And for us, that's a huge thing in immunology because the nets are also a part of the immune system that are directly related to lupus. And then in lupus nephritis, so when lupus affects the kidneys, this study showed that the microbiome of patients with lupus showed decrease in species richness diversity. So basically, again, the diversity of the bugs that were in the gut of these patients were not as diverse, not as rich, especially in patients with higher disease activity. And then they specifically also found that this particular bug, Ruminococcus novis, was directly proportional to disease activity and more pronounced in patients with lupus nephritis. So here are the money slides. So what can we do? So the concept of epigenetics is something that Dr. Sandhu briefly touched on. So what it really means in layman's terms is that our behavior can actually influence our genetic expression and in turn our immune system. This is fascinating. So a study of identical twin adults, not children, found that 70% of the immune function when they actually measured T cells, B cells, inflammatory cytokines was acquired. One twin had big changes and big abnormalities in these immune cells, and the other twin didn't. And so a lot of it is your behavior in your adult life. So diet. I will briefly talk about the diet, and then I'm going to let Dr. Yu really be excited about this because that's his field of passion. So sad. The standard American diet is very sad. It actually confers a greater risk of disease and a greater risk of disease activity. That's been shown time and time again. But there are so many diets out there, and what I want to say, this is how I feel about dieting. Your diet should not be a diet. What you eat every day should not be your diet. It should be your lifestyle. It should be your way of life. And so whether you adhere to the vegan, vegetarian diet, or the Mediterranean diet, or an autoimmune paleo diet, or a lectin-free diet, or do the so there are just tons of different diets, right? I believe that a majority of your diet should come from a whole food, plant-based diet. So as little processed food as possible. So I say like 80 to 90% of it should come from plants. And that in and of itself is basically going to feed the gut bacteria those indigestible fibers. That's going to feed them the good fuel and nutrients that they're going to need to produce those good byproducts to help your immune system. So a part of diet, I guess, is the talk about probiotics, prebiotics, and all of that. So probiotics, you know, there's a lot of back and forth about, so I'm not going to get into too much detail. And the reason for that is because it's a sensitive subject in the sense that some patients actually have conditions called like small intestinal bacterial overgrowth and all of these things. And so if there's something like that that's undiagnosed, you don't want to be taking like, you know, probiotics with millions of colonies of bacteria. So you want to get that under control first. But I do really, really, really believe in prebiotics, which are the food that will then turn into probiotics. And so these are the good foods that feed the good bacteria. Onions, leeks, garlic, asparagus, jicama, banana, the list goes on and on. Dandelion greens, cocoa, flaxseed. And this is just like a small list, but there are big lists online. Fermented foods like sauerkraut and kimchi and kefir and all of that is also very good. And then my philosophy also is eat the rainbow. So I was listening to a Gut Microbiome podcast recently, and one of the experts there said he plays a game with his daughter where they put a picture of the rainbow up on the refrigerator, and it's a challenge every day. They have to nick off the colors as they basically eat the different products of the rainbow or the different colors of the rainbow. So I think that's a really good way or an easy way to try to meet that challenge. So this I've kind of put up here. I didn't include all of the studies and the literature behind them, but these are some of the supplements you can take for leaky gut. But I always say that anything that you take that's alternative, nutritional, supplemental should be discussed with your rheumatologist, because there can always be interactions between some of these things that you're taking and the medication that you're taking. And the last thing you would want is for it to alter the levels of the medicine that you need in your body for lupus. So always talk to your provider before you take these supplements. Turmeric, I did mention that I'll talk about it, is a great anti-inflammatory. So actually in some patients can substitute or at least help them decrease their ibuprofen or their NSAID doses. The only thing with turmeric that you have to be careful for, if you're on a blood thinner like Coumadin or Plavix or maybe even aspirin, it is an antiplatelet or has antiplatelet properties, so it can kind of predispose you to bleeding a little bit more. So just be careful with that. But I usually recommend 1,000 milligrams twice a day. And then another thing that you always have to be mindful of is that the turmeric should also contain, or the supplement should also contain, black pepper extract, because that helps with the absorption of the turmeric. Otherwise, it just kind of goes right through you. So stress. So this is also something that Dr. Sandhu touched on, but I'm kind of bringing it all together. So stress and the microbiome. So we all know that chronic stress is bad for the immune system. Acute stress, we can deal with. We can run on a treadmill for a while, and that's technically acute stress, and that's okay. But it's when the stress is long-standing and chronic where it's pretty bad for the immune system. So what stress does is it increases certain hormones in the body and catecholamines, and that basically also disrupts the microbiome. And it affects the regulation. Remember the vagus nerve I was talking about? So it affects the regulation of the neurotransmitters that can send messages up to the brain. So, and usually stress makes us sad. This is another mechanism by which this can be explained. So the brain is the main organ that processes these stress responses. So when the immune system is actually triggered by stress to generate inflammation, leading to autoimmune diseases and worsening autoimmune diseases, I should say. And then this concept of the acceleration of aging. So if you're chronically stressed, we all know that one person who's been through tons in their lives, and you can kind of look at them and they're 40 and they look 75, right? So it just, chronic stress makes us age much quickly. So the idea of immunosenescence is basically the concept of your immune system dying. So people are actually looking into studying that. There was another study that demonstrated that, they basically made a bunch of people watch an emotionally evoking and really terrible video, and then they took blood samples and actually measured these immune cells, so the IL-1B, IL-6, IL-8, and they measured them. And they assessed also the participants' cognitive control of emotional levels. I don't know how they did it, but it was a test that they gave them to see how, because all of us can kind of digest stress differently. All of us react to stress differently. So the people who were better at controlling their emotional states and controlling how they respond to stress actually had a lower cytokine level, actually had lower pro-inflammatory cells. So stress management. So Dr. Sandhu touched on this. Meditation. So what does it do? It regulates stress response, it suppresses chronic inflammation, and it helps maintain a healthy gut barrier and function. So there's a center called the Chopra Center. Their studies actually have shown that it actually improves gene expression. You can actually manipulate the way your genes are expressed by meditating. It actually increases stem cell production and inflammation. So if all of these things that I'm telling you doesn't, what's the word I'm looking for? Doesn't excite you to meditate, and doesn't, that's the word I'm looking for, doesn't excite you to meditate, then I'll tell you a little bit more actually. So mindfulness meditation is what I usually tell my patients to do. John Kabat-Zinn was the creator of mindfulness meditation, which basically can be in the form of guided meditation. So there are a lot of different ways that you can get yourself to meditate. It's hard to do initially, but can get easier and easier. And it's the concept that people think that, well, they're not like Buddhist monks. They can't shut their brain off completely. And that's not the point of meditation. You're not supposed to shut your brain off completely. So there's an app on the phone that's free actually on most phones. It's called Insight Timer. And it has thousands of different meditations for all sorts of things. So you can search morning meditation. It'll give you a whole host of 2-minute videos and 10 minutes and hour-long videos. And you can start off by doing, once a day, 5 minutes once a day. And then as you kind of get better at it, and if you feel the effects, you can go to 2 times a day, 5 minutes, 2 times a day. And again, that may be too much to ask, so just start slow and then slowly kind of get yourself up. There's a program actually at the Cleveland Clinic called Stress Free Now. That's also a phone program. And they basically say 15 minutes 4 times a week, they've actually found improvement in immune response. So the practice of gratitude. And the immunology of gratitude. So that's actually being studied now. There was a study recently that was done that showed that patients with heart failure had improvements in their ejection fraction when they actually did an echocardiogram, an ultrasound of the heart, after doing gratitude journaling. So they literally just journaled about what they were grateful for, and before and after they did an echocardiogram, and they actually showed that the heart pumped better. The heart was able to pump more blood. So it's just fascinating. So what I used to do, and I'll probably pick back up on doing this, every night before I went to bed, I just jot down in a journal 3 things that you're grateful for. And you can elaborate if you'd like, or you can just literally jot it down. And then that just helped me sleep better, that cleared my mind, and it made me happy. So another thing, and it kind of goes hand in hand, if you're going to journal about your gratitude, that's journaling in and of itself, but journaling about anything, about what you're going through, writing a letter to someone that you don't really feel like talking to, but just writing it out. There was an article in JAMA, which is a big medical journal, on rheumatoid arthritis and asthma patients. It actually showed that by objective measures, they were able to measure that RA symptoms were reduced. There's another really cool concept out there, molecules of emotion, that's being studied by a woman named Candace Pert. So she actually does studies in psychoneuroimmunology. So she, connects the dots between all 3 fields, which is great. And then social connections. And Dr. Sandhu kind of touched on this right here, where most people came with somebody and you guys are there supporting each other. If you're in a conversation that's uplifting, that's happy, that in and of itself has actually shown to improve gene expression, reduce inflammation. All right, so sleep. So somebody asked a question about sleep. So sleep and the microbiome. So studies actually available that demonstrate short sleep durations actually disrupt the gut microbiome. They did another study in circadian disrupted mice and jet-lagged humans, and they actually showed dysbiosis in both of these populations. And we know this too. Chronic sleep disruptions alters the gut microbiota. It causes systemic inflammation. It causes our fat basically to be increased. It causes inflammation there, insulin resistance, and obesity in mice. And sleeping is basically, think of it as the master switch of your immune system. It's the time that your body needs to basically heal and to heal and improve your immune system. So there was a study done in the sleep lab. If patients went in and they were interrupted in the first 4 hours of their sleep, and then they measured inflammatory cells, and they actually had a higher number of inflammatory cells, and they had significantly increased musculoskeletal pain, joint pain, muscle pain. So sleep techniques. So what can you do? Sleep hygiene is a big field. So electronics, I am guilty of this. I sleep with my cell phone right next to me. It's the last thing I look at before I sleep and the first thing I look at before I wake up. I shouldn't be saying that, but it is a terrible practice. I am gonna start plugging my cell phone outside of my room because I find that there's no other way around it, because I still grab it and check emails and do work while I'm supposed to be sleeping. So no TVs, cell phones, laptops, iPads, anything with that blue light that will stimulate your brain. They say multiple hours before you sleep. I say like 2 hours before you sleep. And use your bedroom only for sleep, maybe for one other thing. But do not eat in your bed. Do not read in your bed. Do not do crossword puzzles in your bed. So just leave your bed to your sleeping grounds. And go to bed the same time each night. You know, if you're going to bed at 8 p.m. one night because you're really, really tired, and then you stay awake until 2 in the morning watching a movie, you know, you're just messing with your circadian rhythm. Studies have shown that anything less than 7 hours and anything more than 9 hours actually causes an increased risk of mortality. So, I mean, there are some people that can get by with like 6 hours of sleep every night, and they're okay, and that's fine, I think. But, you know, usually I say about 8 hours is good. And then there's also another app actually at a Cleveland clinic. It's called Go to Sleep. It's an application on the phone. I think it's actually, it costs something, but I've heard a lot of people actually have used this and are happy with it. One other really, really important thing is a sleep study for obstructive sleep apnea. If you snore, if you wake up in the middle of the night gasping for air, that may mean that you have sleep apnea, and basically what that is your body, your brain, and your muscles aren't getting enough oxygen when you're sleeping. So you're starving your body of oxygen. So make sure, if that's you get a sleep study and you get a CPAP if you need it to sleep. And then this ties actually meditation and sleep together. So there was a randomized control trial, which is our favorite kind of trial, of mindfulness meditation and improvement in sleep quality and daytime impairment among older adults with sleep disturbance. So if you get a little meditation in before you sleep, that's even better. This is the last thing I'll be talking about, and then I'll wrap it up. Exercise. So sedentary people are actually immunocompromised, and there have been studies that have shown that they are more susceptible to infection. So if you inoculate someone's mouth, nose with a cold virus, the exerciser will get sick less than the sedentary person that does not move. So moderate exercise, 150 minutes, that's what moderate exercise is defined as nowadays, of any activity per week, really. Even walking, yoga, high intensity interval training, Zumba dancing, water aerobics, anything that you like to do. Just find what you enjoy and try doing that. Extreme exercise, really extreme high intensity athletes, actually they've done some studies about their microbiome as well, and have shown that their microbiome is a little affected as well, and can lead to more infection as well, because think about it, they're in a chronic, almost like a chronic stress response, because they're just overly working. And Dr. Calabrese, the doctor I mentioned earlier, has a concept of instant recess. So basically, if you don't have time to go to the gym for an hour a day, take the last 5 minutes of a few hours of the day to get up and just walk around, your office, especially if you're working at a desk. So what is immune strength? So immune strength, in my opinion, is the key to wellness. So it's patient-driven because it's all the things that you can do as a patient to make your health better. And it's the concept that your behavior actually affects your immune system. The concept that your gene expression is actually affected by all of the things that you choose to do in your daily life, your behavior, what you eat, what you think, the positive thoughts that you have, et cetera, et cetera. So you have the power to influence your immune system. You have the power to change your disease state, to change your disease activity. Let us rheumatologists do the rest of the work and the medications that we give you, the counseling we give you, the guidance we give you. But all of these other things are things that you can do for yourself, and you'll actually see that you can maybe decrease the doses of the medications that you're on, and you'll just feel overall much better. So, and really there are no adverse outcomes to doing any of the things I talked about. And if there are, if you over-exercise and you're starting to feel, more pain, then you should probably back down and start again from square one. But really, overall, there are really no other adverse outcomes. And so immune strength is, I put in quotes because it's not a term that I coined. It was actually a new program that's also coming out of Cleveland Clinic where they're basically going to be, I think they may have launched soon, and it can be anybody from anywhere basically in the country, where they coach in all of these things that I kind of talked about. And it's just a global program to try to increase your immune strength and to optimize your immune strength. So with this, I'll end with food is medicine, meditation is medicine, sleep is medicine, exercise is medicine, and all of those things will affect your gut microbiome, because I had to end it there. And basically health is the sound body, mind, and spirit, not just body. And this is the funniest thing I had seen when I was preparing this talk. I know you may look at me and think I have it all together, but inside my gut flora is chaos. And I found this on Overheard in LA. I'm sure a lot of you have heard this, but I thought it was really funny. That's it. Thank you.
Thank you very much. We are actually going to jump through to our next presentation and skip the break because we're a little bit over time. But if you need to use the restroom or grab water, please do so. We're going to go ahead and get started now with Dr. Yu. So thank you.
Hello. 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 Can you hear me now? Higher. Should I do higher? Should I put it higher? It's loud enough. Hello.
Keep talking.
Hello.
Going through.
Hello. Is it loud enough? Okay.
Well, someone's telling me that they're having a little hard to hear.
Okay. What just says down. Okay. Hi everybody, my name is Micah Yu. I'm a first-year rheumatology fellow here at Loma, and today I'll be talking about lifestyle medicine and Lupus Plus, because I'll be talking a little bit more than just lupus. I'll be talking about some of the complications you get from lupus and some of the risks of other diseases that you can get from just having lupus as well. So today we'll be learning about what lifestyle medicine is. We'll talk about what diet should we eat. What are some of the anti-inflammatory foods that we can eat as well? What foods should we minimize? What food should we avoid? And what else can we do besides eat right? So we touched upon this diet earlier. It's called the SAD diet that Dr. Lafian just talked about. It's also known as a standard American diet. So what's in the standard American diet? Most of us eat this every day. First, we eat Frosted Flakes for breakfast, a bunch of sugary foods. Next, we have a hamburger for lunch. And then if you're at Costco, you get a $1.50 hot dog. After that, you'll go in and out for French fries. You have Doritos for snack. You'll end the night with a cheesecake or ice cream. There's so much nutrition in this food every day we have, right? So much sugar, salt, yes, a lot of processed food, things that we should avoid on a day-to-day basis. And these foods can make our lupus worse. So what foods should we eat? I'll be talking about that in just a bit. So 1 in 5 Americans have an autoimmune disease. That's not just limited to rheumatic diseases. That's including type 1 diabetes, thyroid diseases, neurologic diseases as well. And this from the American Autoimmune Related Disease Association. 1 in 5 Americans, back in 2012, that was 50 million Americans. Today, there's about 300 million Americans. So that's quite a few. So look around in the room. I mean, all of us probably have autoimmune disease, and 1 in 5 Americans, that's 20%. And this is from the president of the American Autoimmune Disease Association. She said, with the rapid increase in autoimmune diseases, it clearly suggests that environmental factors are at play due to significant increase in these diseases. Genes don't change in such a short period of time. We can change our lupus activity, we can improve our lupus activity, but we have to work for it. We have to change the way we live, we have to change the way we eat. So what is lifestyle medicine? It's actually a growing field in medicine now. It was formed here at Loma Linda in 2004, and now it's a growing field. It's nationally recognized. In the summertime, they wrote, summer of 2018, they actually wrote an article saying that lifestyle medicine is one of the 5 fastest growing fields of medicine. And this is the link that allopathic doctors need in order to learn more about nutrition. Because in medical school, we don't get much training in nutrition. We get less than 20 hours in nutrition. And lifestyle medicine teaches us about the proper nutrition and other lifestyle medicine factors that I'll be talking about on this slide. So there are 6 pillars of lifestyle medicine. Most of my talk today will focus on healthful eating. And lifestyle medicine, they promote a whole food, plant-based diet that Dr. Lafian alluded to in her last presentation. Other pillars are exercise, stress management, forming and maintaining healthy relationships, improving sleep, and cessation of tobacco and substance uses. I'll be focusing more on nutrition, talking about a little bit about physical activity and managing stress, and a little bit about sleep. But Dr. Lafian touched on those topics already. So nutrition, what should we eat? So first thing that we should focus on is fiber. Who here counts the amount of fiber that they eat in a day? So a couple of people here. So where is fiber found? Fiber is found in fruits, vegetables, whole grains, and whole foods, okay? So why is fiber so important? Fiber is important because it's anti-inflammatory. Do you know how much fiber the average American gets in one day? It's 12 grams. And the recommendation, the minimal intake, is 25 to 30 grams a day. I recommend eating up to 50 grams a day. 5% of Americans only get the minimal amount of fiber. Fiber is so important. It promotes gut health, which Dr. Lafian talked about in her Gut Microbiome lecture. It increases diversity of your gut microbiome, and it basically feeds your gut flora. And there was a study from 1999 to 2010. They looked at a bunch of 20-plus-year-old adults, and they looked at the amount of fiber that they were eating and the risk of obesity, inflammation in the body. and also the metabolic syndrome. But the metabolic syndrome is a triad of different diseases. It's hypertension, it's diabetes, it's high cholesterol. It's also looking at the fat in your body as well. So when we looked at the fiber, the more fiber the patients ate, the less chance that they were having inflammation, obesity, and metabolic syndrome. So fiber is really, really important. That should be the emphasis of your diet each and every day. We have a fiber deficiency in this nation, and we need to focus on eating more of it. So the anti-inflammatory foods are right there in your grocery store. Spices. There are so many spices out there we can cook with. Avoid the salt, focus on spices. They flavor your foods. Cook at home. There was a study done that looked at the anti-inflammatory properties of different spices, and they found 4 very significant spices. One was cloves, the second was ginger, the third was rosemary, and the fourth was turmeric. Now, I wouldn't say just focus on those 4. I believe that other spices have also anti-inflammatory properties as well, such as cumin, cinnamon, paprika, sage. These are all have all anti-inflammatory properties, and you should eat these in your cooking. And turmeric, I love turmeric. It has anti-cancer properties. It's anti-inflammatory. It lowers your blood pressure, lowers your cholesterol. It does so many things. There's over 6,000 studies done on turmeric. That's why it's picking up so much popularity in our society now. You can buy the capsules. You can cook it with spices. You can also cook with the vegetable root itself. I always advise my patients, try to avoid the capsules and cook with the spices. That's in its purest form. And some other foods that we should definitely avoid are processed food. Do the best you can to avoid chips, the cookies in the grocery store, and the candy. Those are not good for you at all. And finally, eat a whole food, whole fruit, and vegetables. Avoid the fruit juices. When you buy orange juice, apple juice at the store, that's all sugar. There's no fiber in that. And why is it so important to eat fiber? Because sometimes the fruits and the vegetables have something called phytonutrients that are stuck to the skin of your fruit. And that has anti-cancer properties, anti-inflammatory properties, and you don't get that in fruit juices. You only get that when you eat the whole fruit and the whole vegetable. And something that I do at home is I take fruits and vegetables with water or even some soy milk, almond milk, and I blend it in my blender. And you could get the skin that way. That's great as well. But avoid the juices at the grocery store. Make your own juice. Okay, so I'll be talking about vitamin D. So vitamin D, we don't get enough of it. A lot of us are deficient in it. We can get it in some foods. And the sun, it converts the vitamin D into its active form in our body, which we can use. But we do need a supplement. Most of us do. I'm deficient in it. So vitamin D is important in lupus. Low vitamin D has been found in some patients to have increased lupus activity. And also, low vitamin D can also increase fatigue in lupus. That's why it's so important to supplement as much as you can with vitamin D according to your physician's recommendation. Talk to your rheumatologist about whether you're deficient and whether you need to supplement or not. The normal range, low normal, is 30, but sometimes I like to keep my patients around the 40 range. Dairy. So dairy, I don't advise my patients to eat dairy. It hasn't been proven to prevent bone loss. Dairy, they say milk does a body good, but studies have not proven that it helps with bone loss. And actually, there was a study that said that it increased fractures, actually. But I'm more neutral. I'm in the group that says it doesn't help and it doesn't worsen bone loss. So what can we eat to help with osteoporosis and bone loss? There's other foods that I'll be talking about next, but you can get it in almond milk. You can get it in vegetables. You don't have to go to the dairy products. There's a lot of saturated fat in it. There's a lot of hormones in cow's milk. So cow's milk also increases cancer. There's been studies found that it increases prostate cancer and breast cancer as well. So milk cow milk isn't all that great, and we should minimize it as much as possible. So where are calcium found if you don't drink milk? So I don't know if you can see here, oh, it's big enough. So we can get in lots of vegetables, collard greens, kale, broccoli. There's so many fruits and vegetables out there that have calcium, and milk, surprisingly, does not have the most calcium. Next, I'll be talking about how milk here is only 300 milligrams of calcium. If you look in the previous slide, collard greens have more calcium than milk. And broccoli had a lot too, 200 milligrams. And almond milk has a lot, 300 milligrams if they fortify it with calcium. And tofu has a lot, orange juice, and oatmeal has a lot as well. Meat. This is a big topic. We all love meat, but should we be eating it? Is it healthy for us? So the American Cancer Society say that they're going to be lowering the colorectal cancer screening rate. Currently, the colorectal cancer screening rate is at age 50. They're going to be lowering to age 45 in the near future. And red meat has been associated with colorectal cancer. That's a class 1 scientific evidence. And why am I talking about cancer? Because if you have lupus, you have an increased risk of cancer already. That's why this is so relevant to this topic. So that's why we have to do everything we can to minimize cancer risk. And processed meat, that's your bologna, your salami, your hot dogs, your ham. That has been classified as a carcinogen by the World Health Organization in 2015 already. We shouldn't be eating those foods. You're basically brewing cancer when you eat those types of processed meats. So try to avoid that as well. And meat has also been found to cause low-grade inflammation in our body. It does not help with gut health, and it might even cause alter the gut microbiome in a bad way, because some studies have been found, there's a theory that meat, doesn't matter if it's organic, grass-fed, when you eat it, there's bacteria in it already, and that bacteria, there's something called endotoxin in there that causes something called a leaky gut, what Dr. Lafian talked about already, and that bacteria can talk to your immune system, and when that happens, it can cause inflammation in our body. That's why I advise my patients to try to minimize their meat intake as much as possible. It doesn't matter if it's turkey, it doesn't matter if it's chicken, just try to minimize it. So heart disease. Did you know that if you have lupus, your risk of getting a heart attack is 50 times more than the risk of a normal person without lupus? So what causes heart disease? How can we avoid it? What foods causes heart disease? Well, there was a study done in the New England Journal of Medicine. It's a huge journal. It's a very prestigious journal that we have in medicine. And in 2013, they looked at different types of meat, cheese, eggs. And they gave these patients actually eggs, I think every day. And they looked at how it altered the gut microbiome. And what they found was that the eggs, the cheese, and the meat, the saturated fat, it actually altered the gut microbiome, changed the choline to trimethylamine, and then the trimethylamine through the liver changed it into trimethylamine and oxide, which is known as TMAO. And when that happens, it causes plaques in our arteries, also known as atherosclerosis. And through plaques and atherosclerosis, this is how we get heart attacks eventually, when your plaques build up and it blocks the vessels in your heart. So try to avoid, there's scientific evidence for this. It's just not people talking about it. It's proven now through science. Fish, another great food that we love to eat at home. Omega-3 fatty acids, we get this through fish. It's been linked to lower lupus disease activity. It's great for us. There's protein in it. However, fish has a lot of dioxins as well. The World Health Organization has already stated that dioxins is a carcinogen. where do we get dioxins? What are dioxins? Dioxins are chemical pollutants that we get through the industrial waste, through oil spills. And the World Health Organization talked about it accumulates in our fish. There's a line here that says that most of it is in our dairy products, meat, fish, and shellfish. Actually, 90% of our human exposure is from these foods. That's why we have to minimize fish as much as we can because dioxins are in it and it can cause cancer.
So are farm fish better than?
Farm fish are not better than wild fish because it actually might be worse because farm fish, they feed them food that they're not supposed to be eating. They feed them corn, and when fish are dead, they lay in the water with the live fish. When they build up infection, they're laying there as well. It's not a natural habitat for these fish. That's why if you're gonna eat fish, I would say eat wild caught fish. But then again, you have dioxins in there. And another thing that's also in fish, something called PCBs, also known as polychlorinated biphenyls. This is another class 1 carcinogen that's been in the by the World Health Organization and the Agency for Toxic Substance and Disease Registry already. So we get this in the industrial waste as well. Little fish eat this, big fish eat little fish. What eats fish? We do. So this accumulates in our body as well. Now, there's no hard evidence that these toxic substances causes autoimmune disease, causes lupus, but there's links that it causes cancer. And in the future, we might find evidence that it can also cause lupus and autoimmune diseases as well. That's why I advise my patients to minimize these foods. Salt. So we love salt, I love salt, but we're getting too much of it in our society. We should be eating no more than 1,500 milligrams of salt each day. And when you eat out fast food, you're probably getting your day's worth of salt already. And here's another article from the New England Journal of Medicine, the prestigious journal that I talked about already. So they already talked about this. Salt might lead to promote autoimmune disease because when you eat too much salt, it's inflammatory. And if you have chronic inflammation, it can lead to different autoimmune diseases. And they already found the pathway of how salt can lead to inflammation and autoimmune disease already. So try to limit that as much as possible. Also, and eat spices. So the spices I talked about, that can flavor your food when you cook at home. When you eat out, ask them for low salt and low oil. That's what I do when I go to the restaurants. So what should we eat? So this is a basic summary. So if you're gonna eat omega-3 fatty acids, which I recommend, you should eat algae-derived omega-3 fatty acids. Because where does fish get their omega-3 fatty acids from? It's from the algae from the ocean. And if you get it from the algae-derived omega-3 fatty acids, then you can skip the toxins, those that I talked about. Because when you eat fish oil, it still has those toxins in there. Get your vitamin D supplementation, eat anti-inflammatory spices, avoid processed food as much as possible, salt to taste, minimize animal products, and eat more fruits, vegetables, and whole grains. I'm not telling you to go vegan, but I'm telling you to watch what you eat and try to minimize those products as much as possible. So this is a picture, a nice diagram from Canada 2 months ago of what we should be eating. This is a national guideline now. This is a national picture. It made waves in social media. And society, they're moving towards more of a whole food, plant-based eating now because there's evidence of this. So what should your plate look like? Half of it should be fruits and vegetables. A quarter of it should be whole grains. And if you're gonna eat meat, a little bit from beef, from chicken, but your protein should be coming from beans, lentils, chickpeas, different legumes, okay? Some from tofu as well, if you're not allergic to it. And your drink of choice should be water. No diet soda, no soda. Diet soda is just as bad as soda or even worse. Aspartame is very inflammatory. It messes with your gut microbiome. You're messing with your immune system if you eat that. Some of you may flare when you drink diet soda. So we're going to talk about sleep. So Dr. Lafian already talked about this in great detail already, so I'm just going to touch on it already. So optimal sleep is 7 to 9 hours. The American College of Lifestyle Medicine already has, I talked about 6 pillars. All those 6 pillars are important. None is more important than the other. So sleep is equally just as important. You need to control your sleep. If you're not sleeping enough or you're sleeping too much, you need to find ways to optimize your sleep, whether through its meditation, through therapy, talk to somebody, find ways to get help. Exercise. So when I talk about exercise, we don't have to exercise to the point of exhaustion. By what I mean by exercise is just moving. Go have fun, go play with your kids, go dance, go walk, go do push-ups on your knees at home if you have to. You have to exercise, you have to get that weight down. The body mass index, the BMI for normal weight is under 25. If you're over 30, that's obesity already. We need to get that down. The less weight you have, the less prone to autoimmune disease and flares you're gonna be. So move. So 150 minutes a week is what our government recommends. 150 minutes a week, that means 2.5 hours. You don't have to do all that at one time, but you have to break it, you can break it up throughout the week. That's 2 days a week, okay, of just walking, at least. Go move, go swim, do something. Get off the couch. And I recently saw a video on YouTube that talked about people that watch 6 hours of TV a day live 5 years less than a person that doesn't watch TV at all. And the average American watches 5 hours of TV a day. And that's way too much. And when you watch TV, what are you doing? You're snacking off food. You're binging. So avoid it. And stress management is another key component that we talked about previously in our past lectures. So go meditate, go pray, go talk, go be in the community with your religion, go socialize. That's another form of meditation. You're in the moment when you socialize. And focus on your hobbies. Go go find hobbies. When you're in your hobbies, you're in the moment, you're not thinking about anything else. It's very, very therapeutic. So in summary, minimize and eliminate animal products, eat a diet high in fiber, at least 30 grams a day, eat a diet consisting of fruits, vegetables, and whole grains, get a full night of sleep, sit less, move more, and manage stress. And there's a lot of diets out there. I always talk to my patients about lifestyle. I think it's a huge component. You may be able to lessen the dosage of your medications for lupus. Some patients, there's testimonials that they have reversed their autoimmune disease with lifestyle medicine on a whole food plant-based diet, in addition to exercise and stress management. You need to find out what's causing your flares and your lupus and your autoimmune disease. It may be just dairy. Some patients have had improved with cutting out dairy. Some patients improve with just cutting out processed food. You need to keep a diary and find out what you need to eliminate in order to improve your disease. Yeah, that's my presentation.
Does anybody have any questions that they want to turn in? Or do you have an index card?
Sure. Sure. Am I off? Okay. Nuts are good for you, but you need to watch how much you eat because they're high in calories. So nuts are part of a whole food plant-based diet. Try to get the unsalted kind and salt it yourself at home. But overall, they're very good for you. They're high in polyunsaturated fat.
Are there any pros and cons versus juicing, just the juice, versus including the fiber?
So I always recommend my patients to blend their fruits and vegetables in like a Vitamix and not juice it. Because if you're juicing, you're cutting out the skin. And sometimes, like I said, some of the phytonutrients, which are anti-cancer and anti-inflammatory, are stuck to the skin. So if you're not eating the skin, you're not eating the fiber, and you're losing a lot of nutrients. You're not getting your money's worth. So there's a question here. Can you take turmeric if you have GERD? You can take turmeric if you have GERD, but I will talk to your rheumatologist or your primary care doctor and find out when you do take turmeric whether it's causing GERD at all. Each person's different. Each person's physiology is different. So you need to find out whether you can tolerate it or not. Oh, there's a question over there. I have a question here. Even though you recommend a plant-based diet, is it true that some vegetables such as eggplant, tomatoes, bell peppers, are inflammatory to your autoimmune system and can cause flare-ups? So this is so these fruits, these vegetables, eggplants, tomatoes, and bell peppers, they're part of a nightshade family, and some people have actually been found to have joint pains and flares on these vegetables. I've looked this up. I tried to find it in the literature, medical literature, but there's currently no evidence in the medical literature that these vegetables cause autoimmune disease and flare-ups. But patients have reported it, and I believe that these nightshade vegetables can cause flares in some patients. So I would say you have to keep a diary of your food. If you notice that these foods are causing flare-ups for you, then you need to avoid it, even though medical literature hasn't said anything about it. Maybe we just haven't caught up with these findings. How do you feel about the plant paradox diet? So there's a lot of controversy about the plant paradox diet. So the plant paradox diet was developed by Dr. Gundry. He wrote a book on the plant paradox diet. He's a cardiovascular surgeon, so he's not a rheumatologist. And so what they say about the plant paradox diet is to cut out lectins in your body because they can cause inflammation. So lectins are found in a lot of legumes such as beans, and they also are found in some fruits and vegetables as well. But there's no hard scientific evidence behind it. And lectins, they're in a lot of beans, but when you cook the beans and wash it, it actually destroys the lectins, so it doesn't cause flare-ups and autoimmune disease. So a lot of the whole food plant-based community, their MDs and DOs, they've actually squashed the plant paradox diet, and the American College of Lifestyle Medicine doctors have also, with evidence that it doesn't cause flare-ups and autoimmune disease. So there's a lot of evidence against it. How about shellfish, lobster, clams? So shellfish, lobster, oysters, and clams, I would say they're also inflammatory foods. I would say a lot of these foods, such as meat, shellfish, fish, they're inflammatory foods. Fruits, vegetables, whole grains, they promote a healthy gut, a gut health. These are the only foods that promote gut health and healthy gut. So I would say try to avoid it as well. If you don't flare up on it, then continue eating it, but they do cause inflammation, okay? So, and those things such as PCBs and dioxins, they do accumulate in shellfish as well, which the World Health Organization has alluded to already. What do you recommend if someone is allergic to most fruits and plants and all nuts, and how can they incorporate this plant-based diet? So find out what fruits and plants you're allergic to. I don't think someone can be allergic to all fruits and plants. I'm not saying it's the end of the world if you eat fish and meat, okay? But you should try to minimize it. I've had people come to me, they said that they can't eat whole food plant-based diet because they're allergic to beans and lentils, and they can't get the protein that way. I say, that's okay. Then look for alternatives. And if those alternatives don't work, then eat some meat, eat some fish. It's not gonna kill you, but know that it doesn't help with gut health, and gut health is connected to our immune system, which is then connected to lupus. Oh, by the way, one more thing. On that question about there are lifestyle medicine doctors that you can find. Just go on American College of Lifestyle Medicine, and they're out in our community, and it's a new field, so you can find them and they can talk to you about your diet.
And now we're going to have our last presentation with Mr. Dojo Aguilar. So thank you.
All right, good evening, everyone. So I know that I'm the only one between what has been an amazing night of education and getting at least 7 to 9 hours of sleep, okay? So I will make this very short but very sweet. But before I do that I will be a very good student of Dr. Lafian tonight, because I think most of us here has been sitting now for at least an hour. And so it is encouraged that if you've been sitting at least an hour, that you take that recess for 5 minutes. But we'll not do it for 5 minutes, but maybe for a few seconds. So, you know, I would like to ask if you want to stand, just stretch, you know, you can do that. And I would like to ask a favor from all of you. Once you stand up, okay, do that arm extension. Just say to the person on your right or to your left or behind you, you are not alone. Awesome. Thank you so much. So you may be seated. So at least I saw some smiles, and that's what Dr. Lafian recommended, that, you know, a simple, I think, expression of gratitude is very, very helpful. So again, my name is Dojo Aguilar. I'm a registered nurse. I'm actually a nurse educator, patient engagement liaison with GlaxoSmithKline. And so my thing tonight is just to introduce to you about a program that my company, GlaxoSmithKline, has developed now for about 4 years. And this is called the Us and Lupus program. So you may probably have gotten this on the packet that you got, this little brochure. This is our Us and Lupus brochure. And basically, I just want to share to you some tools and resources. Again, this is not the end-all, be-all of tools and resources, but this is just one of those resources that hopefully, I always am a firm believer that no matter what, how good a tool is, if you don't have a motivated person or patient behind that resource or tool, it will always just remain a tool, right? And so hopefully tonight I'll be able to share to you some of these resources. And my goal is hopefully this will help you become a patient that is more empowered, more proactive to be able to manage your lupus, and also to be able to improve the way you dialogue with your healthcare provider. Because, you know, managing chronic disease, communication is such a very important component to disease management. So where can you go for help? Again, the center of all this is you. Again, all of what we have heard tonight, you know, will not come into fruition unless you are empowered, you are proactive, and you are motivated. And so you can see here, you have a lot of people around you. You are not alone. That's what they say. It takes a village to actually manage lupus. You have your healthcare team, your family, your friends, patient advocacy groups, and hopefully the Us in Lupus program can help that. So the Us in Lupus program has been designed by GSK, hopefully to offer people like you living with lupus the skills, tools, and confidence you need to help you face your lupus. Again, these are some of the important tools that hopefully will help you prepare for your appointments and will help you learn more about your lupus. So at the back of this brochure, there's actually a business reply card. And if you want to be part of this program, all you have to do is just fill up that program and drop it off in the mailbox. And I will go one by one. These are some of the resources that you can get for free over a period of the first 12 weeks upon enrollment. So you can get a lupus checklist, a lupus impact tracker, a lupus log, lupus journal, appointment prep guide, and actually there's a lupus dictionary that help you better understand some of these medical terminologies that you may hear from your healthcare team. So one of these tools is called the lupus checklist. And again, let me ask you this. How many of you have either minimized or underreported your symptoms when you have your appointment with your physician? Minimize or underreported your symptom, right? Very, very common in patients with lupus. And a lot of those, there's a lot of factors, right, that could affect that. And so this simple checklist will help you recognize the symptoms and risk factors for lupus. It actually allows you to keep track of some of the symptoms that you may have, like every day, every week, because in lupus, sometimes the flare, not sometimes, but all the time, the flare waxes and wanes. You have good days and bad days, right? So I think by helping you track your symptoms would hopefully help your physician better understand if your disease is still active or not. There's also this lupus impact tracker. It's a simple worksheet that can help you determine a rating of how lupus is also affecting your life. This tracker has actually been developed by Rush University in Chicago, and they allowed GSK to actually promote this. And this is a good tool to help you determine how really lupus is affecting your day-to-day life. My Lupus Log. So this is an app that's available on both Android and iPhone that, again, helps you could really track your lupus symptoms. So some of you that may be savvy with technology, this is also an app that you can download in your phone. This is actually a very nice lupus journal that you can get in the mail when you enroll in the Us and Lupus program. Again, this is a way just to document your thoughts, your feelings. As you know, most of you living with lupus take a lot of medication. Very, very important to also make sure that you document those things. There's also an appointment prep guide, right? We know that our physicians, because they see a lot of patients, sometimes they have limited time, with each one of you. But I want to encourage you as a patient, as a family member, it is also your responsibility to really prepare beforehand when you go and see your physician. So this is just a handy checklist that will help you make the most out of your medical appointments. Again, there's also a lupus dictionary that actually is available through the Us and Lupus program that will help you understand some terminologies like ANA, anti-double-stranded DNA, anti-Smith, and all those just, sometimes very foreign words to all of us. So I just want you to spend maybe a few seconds and just reflect on these questions that you see in front. So I know that most of you may have different answers to these questions, right? And so my encouragement to you is, again, hopefully these tools and resources that I just went through, hopefully will help you just, become a more proactive, patient and family member and caregiver. I mean, earlier I met what they call a patient and their family member who's been here for the first time. And so just having this kind of tools and the support group around you hopefully can be helpful. Again, I would encourage you to seek patient support, and that's why we're so thankful for an organization like Lupus LA, who really, really are into patient education. And mind you, I've been a nurse for 20 years, and I was just, so captivated by Dr. Lafian's presentation about the, microbiomes, whatever is that, and I mean, honestly, like I didn't know that there's a lifestyle medicine now. And so, mind you, when I get home, I'll be in my computer trying to research more of that. But it's just so fascinating. But we have a lot of organization available in the community. We have the Lupus Foundation of America, Lupus Research Alliance, the Lupus Initiative. And these are just some of the lupus organizations that you can be a part of, all right? But again, nothing, is more important than really you being the patient that's proactive, that's empowered. I always believe that knowledge is power. And so I really want to encourage you to really educate yourself more about lupus. And again, you are not alone, especially that this disease, affects 90% of, women in their childbearing age, okay? My boss actually has lupus. At GSK, lupus for us is very personal. My childhood friend has lupus. Me being a nurse and I work in trauma, I work in rheumatology now for 14 years, I've seen many, young patients and it's still a very challenging disease. But again, I always encourage them to seek for help, seek support, really maintain an open and honest communication with your healthcare team. Your physicians are not mind readers, so don't expect them to guess everything unless you really tell them, especially when you feel like you want to minimize your symptoms. Never minimize your symptoms, even if you think whether what you're feeling is related to your lupus or not, right? So don't be embarrassed. Ask for help. Utilize your healthcare team. Utilize your friends and families. And I would like to encourage, some of the husbands here, some of the, men here. I know, and I've seen this, heard this from lupus patients, that most of the time when they tell their husbands or significant others, and most of the time they get this response, oh, it's all in your brain. It's all, this is nothing, right? Please support your loved one, support your spouse. So as a summary, you as a patient and family are a key component in assessing your disease activity. Know that you play an important role in managing your lupus. Again, promote honest and open communication. Take advantage of tools and resources available to you. And please stay active in being educated in your lupus. And with that, I thank you very much for a wonderful evening.
Thank you so much. I'd like to give a special thank you to GSK, our sponsor of this event, which allows us to offer this great free resource to the community. So thank you. And so now we're wrapping up the evening. We're going to draw our raffle prizes. We have 2 prizes, so get out your tickets and get those ready. And before you leave for the evening, please fill out the survey that you have in the folder and turn it in on the way out so we can take a look at your feedback. And thank you so much for coming. So we will pull the first winner.
Is there anybody that did not get a ticket from me when you checked in? All right. This will be the last 3 numbers. The first 3 numbers on every ticket is the same, so I'll be reading the last 3 numbers. First prize we have is a lovely skincare package prize sent to us by ProCara. And the last 3 digits on that are 700. 154700.
Yay!
Hooray!
Congratulations.
All right. And our other prize, our grand prize, is a lovely basket from our friends at Paramount Pictures. It's a collection of DVDs and movies. And the winner on that is number 786. 154786.
786. Hey, congratulations. Thank you so much for coming. Please turn in your surveys on the way out. Thank you. We have a quick announcement.
So I have a quick announcement I forgot to talk about. So we have lifestyle medicine here at Loma Linda, and my wife is sitting here in the corner, and she's a lifestyle medicine specialist here on campus. So if you have questions, you want to look for a lifestyle medicine doctor here at Loma Linda, then you could talk to her here in the corner. Thank you.